Welcome to Eshowe, KwaZulu-Natal, the region at the epicenter of South Africa's HIV and TB epidemic. In 2011, MSF launched an initiative in Eshowe called Bending the Curves. Bending the Curves piloted models of HIV care centered around patients and communities. The project was a resounding success. A 2018 follow-up survey found that 90% of people knew their HIV status. 94% of those people were on treatment, and 95% of those had suppressed viral loads, meaning that the project had surpassed the UN Global HIV treatment target of 90-90-90 2 years before its 2020 deadline. Having achieved this, Doctors Without Borders has now set its sights on the next challenge: tuberculosis, South Africa's biggest killer disease.
The main aim of the project now is that with these lessons that we learned from implementing our HIV strategies, how can we make that work together with innovative strategies? How can we make that together work to do TB cascade strengthening? In our catchment area, we have a very rural area called Mbongolwane and a semi-urban area that is called Eshowe. And so if we want to introduce new models or we want to pilot innovative strategies, we can really see in those two different settings how do these strategies have to be adapted to work in each of these settings.
Tuberculosis is a curable disease and commonly affects the lungs of patients. Despite being curable, TB remains the #1 killer of people living with HIV and one of the top 10 causes of death worldwide. Millions of patients around the world do not have easy access to testing, and as a result, their cases become missing cases. Finding these missing cases is crucial in reducing the impact and the spread of TB in vulnerable communities.
In the year 2001, I was coughing a lot until I coughed blood one night. Then I went back to the hospital and complained about coughing blood. They did screen me again and take me the X-ray. Then they found that I had TB. My TB was never detected for 6 months.
Patients worldwide face a multitude of challenges when it comes to treating TB. From difficult treatment regimens to undiagnosed cases and difficulty accessing health centers. Patients with TB can also face discrimination and stigma from families, friends, and in some cases, the healthcare systems meant to help them.
I went home and disclosed about that. I've told everyone that I've had TB because that time my 2 children were very small. So I thought maybe they are going to give me the support. But unfortunately, I never get the support. They only said, I'm lying, I've got HIV. You can't have TB while you don't have HIV. They were calling me names and I even chased away from home.
The challenges of stigma and late diagnosis faced by Pendile in her battle against TB are all too common. Reducing the impact is at the core of MSF's work in Eshowe.
We have 3 big objectives, in fact, in the TB. We want to enhance TB prevention, because that's very important. If we want to work on TB, we have to work on this preventive component. Second objective is finding the missing cases, because we know globally we are missing to diagnose 50% of the TB patients. So how can we improve that? And our third big objective is improving the TB treatment outcomes. So if we can put all those strategies together, we believe that with TB, we will be able within 3 years to say that we have also exceeded the 90-90-90.
Join us over the coming weeks as we take a look through a series of videos at the models of care MSF is using to reduce the spread of TB and improve care for patients living in the Eshowe and Mbongolwane area.